Hello everyone, my name is Katesi John. I'm working with this project with Makanga Christopher. Worked on a project Dictator Twin for predictive drug consumption and generative AI for personalized treatment plans. Substance abuse is a global epidemic, and this results in severe consequences for the individuals that use the drugs. There is a high rise in related drug deaths, and in case one is admitted to hospitals or these healthcare centers, there are high care costs, and this calls for urgent interventions to mitigate the crisis. So when we look at the existing approaches, they often fail to address the complexity factors influencing drug consumption. For example, the demographic variables, psychological profiles, social influences, and physiological profiles. We did a dictator twin technology, which is a virtual representation of physical entities, and this offers a promising avenue to create personalized profiles that can predict and monitor behavior in real time. So, simple background, Uganda has one of the highest per capita alcohol consumption rates in the sub-Saharan Africa. And earlier study showed us that approximately 39.1% of children aged from 12 to 24 years of age use these drugs regularly. And there is a high recurrence rate and extended recovery periods that affects the socioeconomic fabric of the society. So we introduced this dictator twin technology and generative AI that addresses these issues by offering predictive health care. Some of the related works looked at a paper called Personalized Medicine in Substance Abuse Treatments, which was published in 2021. They explore the application of digital twin technology in personalized medical care and substance abuse treatment. They built a digital twin, but then their research had limitations where they neglected the role of personalities in substance addiction. Also looked at a digital twin technology in healthcare, which was also published in 2021. So their study showed that the digital twins could simulate patients' condition in real time to predict outcomes and optimize treatment. Their study also had limitations. For example, they do not account for treatment optimization. So these are our computational problems. For example, multidimensional complexity. When you look at the patient-specific data, for example, psychological responses, behavior tendencies, and adherence patterns, they are complex and interconnected. So if one is to do modeling, the real-time dynamic requires handling non-linear interactions and high-dimensional data. Yeah, we also have dynamic adaptation, where the treatment plans must evolve in response to the continuous changes in patients' health, behavior, lifestyle, and this makes the static models inefficient. The models are also black box in nature, so we need to understand what are the features that contribute to the model's predictions and performance classification. These are our proposed solution, where we attribute a dictator twin technology where we're going to simulate these patients in real time. Then we're to create a generative AI for personalized treatment, where we create personalized treatment plans for these patients based on their behavior data or the psychological or demographic data. Then we also to do dynamic adjustments where we use this data in real time and also apply explainability to the models so that we include transparency. These are our objectives, for example, to develop a predictive model that forecasts drug consumption patterns based on demographic, psychological, and behavior data, then to create a digital twin system for simulating patient-specific drug consumption scenarios, then to design a generative AI model that proposes and continuously adjusts personalized treatment plans, then to implement explainable AI to ensure transparency in predictions and treatment recommendations. So this is our methodology. We have started by collecting data. We used the data set from the UCI machine learning repository. We did exploratory data analysis on it, and then did data preprocessing, where we engineered the features, balanced the data sets, did feature selection, and data split the data into training, testing, and evaluation. We did surrogate model building, where we built a dictator twin model, where we trained it, tested it, evaluated it, and did hyperparameter tuning. So we got a data set from the UCI machine learning repository. So this data set contained records of 1,000 1,885 respondents, and they had features like personality measurements like neuroticism, extraversion, impulsivity, demographic data like level education, age, gender, and then the data set contained 18 legal and illegal drugs, for example, alcohol, amyl, and then there was also one fictitious drug called Semerin.
Yes, thank you very much. So these are some of our EDA results. The shape of the data set is 1884 by 32. And then the data set had no missing values. A few of these others, we are going to look at them from our code. Let me see from some. So yes, as we can see, most of the individuals from our data set are from the UK, and then most of the individuals have a a doctorate degree compared to those with high school diplomas, meaning most of them are land, and then most of our features like NSCO, ISCO, OSCO, all personality traits and psychological behaviors, they are normally distributed, meaning they are centered around the mean. And then most of the people are whites in the data set. And from these graphs, we see that there are more people that have used alcohol for more than a decade than people that have never used it. And then there are more people that have never used Amphit compared to those that have used it for a decade plus. And then we saw that there are more men that have used nicotine compared to women. And then we discovered that the difference between men and women, as you can see, is not very big for caffeine, alcohol, and the like. So there is no big difference between men and women. And ages, we discovered that uh, there are more people in the age 18 to 24 that have never used the drugs compared to 65 and above, drugs like Afent and others. And when we came to our correlation matrix, and we saw that drugs like mushrooms and individuals that take LSD are most likely to also take mushrooms. And you also noticed that individuals that take cocaine um, are also most likely to take ecstasy. And we also discovered that individuals that are very impulsive and sensational and seek sensation are most likely to be addicted to these drugs. And from this step, um, we also did feature selection. Feature selection, we used a technique called recursive feature elimination, where we iteratively removed the less important features based on model performance, and then random forest importance. Then we came to balancing. Some of our data set was imbalanced as some majority of there were very many non-users for specific drugs. Then we had to perform smart or synthetic minority oversampling technique on our dataset to balance it. And now we came to modeling, where we built our models.
Yes, let me continue from that. We did modeling in two ways, where we did binary classification and multi-label classification, where in binary, we're predicting each drug alone. For example, heroin. We used models like logistic regression, rich classifier, support vector machines, and random forest. And support vector machines and random forest came out the best with 98%. And then rich classifier was not performing so well because it had a percentage of 48. Then we had Amphets and other drugs. These are some of the drugs, but we have also other drugs. We use the same models. And here, support vector machines came out the best with an accuracy of 90%, and which classifier was not really performing well because it had an accuracy of 37%. We did multi-label classification where we classified all the drugs at once, and we used models like logistic regression, XGBoost, exploratory classifier, and CatBoost. and XGBoost came out based with an accuracy of 88%, and logistic regression was not performing well. It had an accuracy of 52%. So we did explainability to these models, where we did feature importance for the XGBoost model, and we look at these personalities features that really contribute to our model's performance. For example, ecstasy, drugs like meth, coke were really contributing to our model's performance. And then the features, for example, age was not contributing much to our model's performance. And then drugs like alcohol, ketamine, and others. Yeah, then looking at this other explainability, it shows that age, and since there is not much difference between men and women in taking the drugs, it was not really contributing much. But then looking at things like the O score, and then A score was really contributing to model's performance. Then we built a dictator twin model. Well, we used Python to develop our dictator twin, where we created a surrogate logistic regression model and then an error correction XGBoost model. And then we later merged them to create a single dictator twin model to perform the different predictions on the data. Here we are going on purifying the outputs through using this error correction XGBoost model. Yeah, so this model and then evaluated it, where we used metrics like area under a curve, where we had before even testing it, our dictator twin had a test accuracy of 88%. Then we evaluated it using area under a curve, where we had an accuracy, an area of 93%. Then we did explainability on it, where we found out that drugs like amphet were really contributing to the model's performance, cannabis, ketamine. But then looking at things like gender, since there was not much difference between men and women in taking drugs, it was not really contributing to the model's performance. And Osco, heroin, yeah. Let's go to the simulation bit.
So when we came to the simulation, we performed our simulation from any logic. And when we came to any logic, we performed agent-based model simulation. This is because individuals in our dataset are looked at as agents. And these agents were given parameters. These parameters are the features that we have been talking about, like N-score, E-score, O-score, and C-score, impulsiveness, sensation seeking. Now, these features will be very important to determining uh, drug addiction, as we shall see. Now, an individual or an agent in our simulation is in any of these 6 states at a particular time. They have either never used the drug, they are experimental users, short-term users, moderate users, long-term users, or addicted. And we use the parameters plus we use the other parameters and risk analysis to determine how an individual moves from one state to another. Now, when we run our simulation, we are going to have a look at our results. We start, as we can see, this blue represents never used. So these individuals have never used a drug, have never used any drug before. Let's try to speed it up. Now, when you increase the speed, you see that they start moving, or after some time, our individuals have used the drug. So we have some experimental users there. We have some moderate users in there, short-term users. And now you see as time goes on, they go on changing from experimental users to long-term users, short-term users, and more other classes as time goes on. Now, these graphs here always tweak when something changes in our data set. And as you can see right now, nothing is changing, so they are not tweaking. So they are responsible to inform an individual when a patient, a user, when any individual's data in our data set changes. Yes, so that was our simulation in any logic. Now, from any logic, we went ahead to we went ahead to to build generative AI. Now, when it came to build generative AI, we merged it with our digital twin model. This is what my colleague was talking about, how we defined as get class. And as you can see, the area under a curve for 93% and the explainability for our digital twin model. Now, when it came to to create generative AI for treatment plans, we used the OpenAI's GPT 3.5 Turbo model. Now, what we did with this model, we defined a generation function, and this generation function, we augmented our query in this function. How? So with this function, we pass patient data. This patient data could include the features that we have seen. Now we shall be using our test data set in this scenario, and then in one of the scenarios you're going to see, and then the predicted condition. This predicted condition is passed from our digital twin model to predict whether the individual would likely be addicted or not addicted to a particular drug. And then the the prediction probability. This probability determines uh, the extent to which an individual is addicted, and the model accuracy, it shows the accuracy with which this prediction is made. Now we added more context to our query, and this context is generate a personalized treatment plan and blah blah blah. We gave it definitions for the features and all the other things. Now, when we came to the results from our generative treatment, we have patient one treatment to patient one treatment plan. For our first patient, we said these are from our test data set. And it says based on the patient data provided, the predicted condition is 0, meaning this individual is most likely not to be addicted to drugs with a probability of 0.10, meaning they have a probability of 0.10 to be addicted to a drug and 88% model accuracy. So it goes ahead to give you some of the plans on how we can keep this individual from getting addicted to a disease. And then uh, it continues to say that it is important or it is crucial to assess the patient's overall mental health and well-being and other issues that it continues to talk about. Then we look at the treatment plan patient 2. It talks about this patient has an E score of 0 and a low probability of a probability of 0.02 to get addicted to drugs. The patient is because this patient is not likely to exhibit extraversion traits. So they are very introverted, they keep themselves. So it's most likely to not find this person in bars or other places. Patient 3, the same patient 4, and other patients. It gives you the patient and how you can so, for example, this patient, they tell you you can take them through psycho education, cognitive behavior therapy, stress management techniques, and other life management information. So, uh, in conclusion, we see digital twin technology as a technology with the ability to revolutionize the existing methods of diagnosing and predicting substance abuse and addiction. And in the future, we would want to apply sensors to our digital twin such that we can collect real-time data and be able to edit to make real-time predictions on what an individual can do. We'd also want to design a graphical user interface for our digital twin and generative AI model. And we would want to perform advanced hyperparameter tuning on our digital twin models to provide better predictions. Thank you very much. These are some of the citations that we've used in our presentation. Thank you very much for watching. In case of any comments, kindly leave them in the comment section. Bye-bye.